struggling with weight can increase your risk of developing non-alcoholic fatty liver disease, NAFLD, according to recent research. A study also found that those who stick to a healthy vegetable-based diet is less likely to suffer the metabolic disease later in life. Scientists in Tehran, Iran and in China carried out large studies to identify lifestyle factors that can impact the chances of NAFLD. The team in Iran, led by Dr. Zahra Yari, carried out research with 452 participants who suffered with the condition in order to analyze a potential link between obesity and the liver disease. Previous studies suggested a link between the two health concerns, but the research in Iran was the first to specifically track the impact, reports the Mirror. Although non-obese NAFLD patients have been shown to share clinical outcomes with their obese counterparts, there is not enough evidence on the cardiometabolic status and disease severity in lean NAFLD, wrote investigators. Also, the differences in the characteristics of obese and non-obese NAFLD patients remain poorly characterized. Our results disclose that both obese and non-obese NAFLD patients shared several clinical and laboratory characteristics, although METS was more prevalent among obese participants. In addition, according to the analysis, the risk of metabolic syndrome and the severity of fatty liver increase along with increasing BMI. These results may have significant clinical implications, concluded investigators. Carried out by the Department of Clinical Nutrition and Dietetics at Shahid Beheshti University of Medical Sciences in Tehran, Iran, the findings were published in the journal Scientific Report. Another piece of research carried out in China also concluded similar results, finding a link between weight and NAFLD. However, the researchers from Yanling LV and Liang Chen at the Huazhuang University of Science and Technology analyzed this through a different lens, analyzing the link between diet and the liver condition. In the present longitudinal study, we found that greater intake of plant-based diets, particularly healthful plant-based diets, was associated with lower NAFLD risk and liver fat content, while a higher unhealthful plant-based diet index, UPDI, was associated with increased NAFLD risk and higher liver fat content, the Chinese scientists wrote. Those involved in the study who stuck to a healthier, veg-based diet were found to have a 22% lower chance of developing NAFLD. Those who ate a diet deemed unhealthy, rich in meat and fat, were found to be at a 24% higher risk of the potentially dangerous liver condition. The study involved 159,222 participants from the UK Biobank who had not been diagnosed with NAFLD at the beginning of the research, tracking these patients to find out how many were later diagnosed with the metabolic disease. Non-alcoholic fatty liver disease, NAFLD, is a condition where those diagnosed suffer damage to the liver, with this damage not caused by alcohol. The condition is instead caused by fat in the liver, with obesity, high blood pressure, high cholesterol and other related issues linked to an increased risk of developing NAFLD. However, the disease can develop without any outside factors in some cases. What are the symptoms of non-alcoholic fatty liver disease? In many cases, NAFLD does not cause noticeable symptoms in the early stages. Many are unaware they suffer unless the condition is diagnosed during tests, often carried out for another reason. However, some people experience symptoms in the more advanced stages of the disease, according to the NHS. These may include, a dull or aching pain in the top right of the tummy, over the lower right side of the ribs, extreme tiredness, unexplained weight loss, weakness. Don't miss the latest news from around Scotland and beyond. Sign up to our daily